Hello and welcome to Health Professional Radio. I'm your host, Neal Howard, for this Health Suppliers segment. In studio today is Mr. Brady Ranum, Vice President of Product and Strategy for Dizzion. He's got over 2 decades of experience in IT infrastructure technology, and according to our guest, the top 3 causes of PHI breaches are lost or stolen computing devices, unintentional actions or mistakes by employees, and irresponsible third parties. Welcome to the program, Brady.
Thanks so much, Neal. Thanks for having me.
Thank you so much for coming in today. You're Vice President of Product and Strategy for Dizzion. How long has this company been in existence, and exactly what is Dizzion involved in?
Well, Neal, Dizzion's been around since 2011. It was started by our 3 founders, and really what they saw is a need in the market to not only separate end users from devices, but also help enterprises secure their data, and in doing so, taking advantage of the huge capacity and the huge capability of the cloud computing.
Are you saying transferring hard copy on-site storage of HIPAA items and things of that nature, all of that being transferred to the cloud?
No, actually what our technology does is allows customers or end users that need access to that information to access it no matter where it sits. So it could be in a cloud provider, it could be in-house in the healthcare provider's data center, and we can allow secure access to that information by using cloud technologies that we deliver to the end users.
Now, you've been around since 2011, and you've got a couple of decades of experience in infrastructure technology. Is your background in security?
My background has spawned everywhere from the data center itself all the way through the security and the databases that house the data. So I've got a little bit of a unique perspective in not only making sure that the data is available and the uptime is great around that data, but that data is not only held securely but in a compliant manner and also accessed in a compliant manner.
Let's talk about some of the aspects that are specific to the healthcare industry when it comes to, securing their infrastructure.
Yeah, absolutely. And so, kind of as you mentioned at the opening, when we look at the way that data is lost or quite literally the way that folks are getting fined or healthcare providers are getting fined for the loss of PHI or personal health information, what happens is the greatest 3 ones are really tied to people and how those people access that data or what the access to the data is. And what we allow companies to do is leave the data where it is, but give a different way to access it. And by doing that, we put a virtual desktop that we host in our cloud environment and allow access that's secure to that data, but it doesn't allow them to move that data or transmit that data or store that data on their local device. And in doing so, it's great because we don't restrict it down to a device, so it doesn't have to be a specific laptop or a desktop. It could be an iPhone or a tablet or even a Google Chromebook, and still allowing that data to be secure, stay in the place where the healthcare provider wants that data, but also allow that end user to do their job and not tie them to a device or a location.
There's some compliance issues that almost have nothing to do with the technology that's going to be used to secure them. How does your technology, although extremely efficient, maintain compliance?
Well, with HIPAA, there's a lot of different portions of HIPAA. There's, I think 280 different pieces or different points that you really have to comply with within HIPAA. Now, we don't say that we absolutely cover every single one of them, but as far as how your end users access that data and the security that has to be around those end users, we help companies provide that. And so we help them enforce their policy, and even amongst a lot of things that weren't able to be solved with technology, they were more solved with a policy or a procedure that end user had to comply with. We're actually helping companies do that with technology. For instance, if they say, hey, you know what, you can't copy and paste this PHI data from the application into another application or into a Word document or an email, we can actually restrict that end user's ability to do that. And we do that right through our technology. So where that might have been a policy before, we can actually implement that as a technology for that end user or for that company to put in place for their end users.
When a company or a healthcare facility comes to Dizzion, how often are you completely doing away with their current method of storing sensitive data and being compliant? And how often do you couple your technology with existing technology, or is it a combination of the two depending on the client?
We can certainly do a combination of the two, but typically what we're doing is we're integrating with a lot of the technology that they're already using. Most of the time, our customers have made large investments in security, and it's not just something that they're ready to throw away. And so that's where a lot of the customization of our solution comes in play. If they've already spent a lot of money around their security, there's pieces and parts that we don't necessarily need to provide. And so it's not, we don't try to do the, the round peg in the square hole type thing. We actually flex and move, and based on where they've made their investments, we can take advantage of those existing investments. Now, there are definitely times where they've tried to deploy a similar technology to ours, and that's really where ours has an advantage, is it's affordable, and it performs better than the in-house deployments. And so now they can focus on their business and treating patients versus a desktop or an operating system that doesn't really provide a whole lot of value.
Now, just the nature of the business has you, I guess, very open-minded when it comes to new technologies and platforms. But when it comes to some of these established healthcare facilities, or maybe some healthcare teaching facilities, maybe some of that resistance to change will rear its ugly head. What about training when Dizzion steps in and begins to consult and possibly implement some of this new technology? How do you train your clients' employees? Do you have a separate entity that does that for you, or are your folks there at Dizzion versed in that as well?
Well, we definitely do a whole lot of education when it comes to the technology and the security pieces. The great part about our technology is the end user training is really simple as going to a website and downloading the client. It takes about 3 minutes to install, and then the end user has no additional training because they're accessing the same applications, and they're doing it through a desktop experience. As long as they've ever used a Windows operating system or a desktop operating system, it's very intuitive because that's really what they're accessing. It's just hosted outside of their actual physical machine, and allows that separation of that healthcare data and that end user's machine, or their ability to store it or move it.
Let's talk about Dizzion.com. When we navigate over to Dizzion.com, what would we expect to find as far as information and history about the company and more?
Yeah, so if you go to Dizzion.com, one thing you'll find is some testimonials from our customers and our partners. You'll also find one of my favorite pieces on there is there's a video that really explains how we separate those end users from the data, and also give them higher customer satisfaction, and also end user or employee satisfaction gains, because it gains them a lot of flexibility around how they work. The other thing you'll find there is a lot of the technology that we've developed, all the way down to even endpoint devices. We've ended up coming out with our own endpoint devices, so no longer do you need a laptop, no longer do you need a big computer sitting under your desk. We've got devices that are actually as small as an iPhone 5, or another device that's about the size of an Apple TV, a little larger than that, that becomes really your computer. You access our desktops from those devices, and you don't have to worry about all the other pieces, like a hard drive failing in a computer, or needing more memory in that computer. All of that is done within our cloud service. And so it's really just an access point that can be locked down and controlled and secured by Dizzion. Website is the best place to go to get in contact with us, and has the most information. Right. There's several places in there where it's going to tell you if you like more technical information or sales information. Absolutely, we even have live chat on that website. So any of those types of methods to get in touch with us are great.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard, with Mr. Brady Ranum, Vice President of Product and Strategy for Dizzion, talking about securing infrastructure, especially when it comes to the healthcare industry. Great having you here with us today, Brady.
Neal, thank you so much for having me.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.